Welcome to WCG Talks Trials, the podcast where we dive deep into the world of clinical research, sharing the latest trends, insights, and best practices from experts across the industry. In each episode of WCG Talks Trials, we'll explore a different area of the clinical trial industry, while featuring a diverse range of clinical research and medical professionals. If you're passionate about advancing clinical research, improving patient outcomes, and driving healthcare forward, then WCG Talks Trials is the right podcast for you. We are so glad you could join us today.
Hello all, I'm Erin McDonald, Medical Chair Director for WCG's IRB. It's my humble pleasure to be discussing e-consent with one of our most seasoned and thoughtful IRB chairs, Erin Brower. A really important topic, especially in this modern age. So, Erin, tell me, what does e-consent mean to the IRB?
Hi, Corinne. Thanks for having me on. E-consent can mean a few different things, but what we really mean is that it refers to the process by which a participant's signature is obtained and documented electronically, but it can also refer to other aspects of the informed consent process. It can describe the exact representation of the document that the IRB has approved. It can also, and once that document is put on an electronic device, that becomes an e-consent, but it can also refer to the process of obtaining consent that uses electronic devices and other aids as tools as part of the process that are beyond just the signature. FDA and OHRP have a joint guidance on this topic, and you can find the link to that guidance on our website. There's a blog post on this topic that has that guidance link.
That's great. Those guidances are so helpful. And it sounds like there's a couple different things going on. So is an e-signature different from e-consent?
It is, but I think in the IRB world, we tend to use those terms kind of interchangeably, and that creates a little bit of confusion, especially when we're trying to figure out what we're approving. So the e-consent is specific to the documentation and the generation of a signature. And e-consent refers to the overall consent process, which might include technology or other devices to support or replace a face-to-face wet signature process. FDA does offer a very technical definition of what e-signature is. And again, in our blog post, there's a link to that FDA definition.
So e-signature really being specific to the documentation, kind of the signing of the form, while e-consent is the larger form. So that kind of begs the question of e-consent being the larger process. Is e-consent different from remote consent?
It is. And again, I think sometimes we use these words interchangeably, but what we really mean is that e-consent can be part of a remote consent process, but a remote consent process does not mean that you have to use e-consent. So an example of a remote consent process that does not include e-consent would be if you obtained consent via a telephone conversation with a participant, and then that person signed a paper copy of the consent form and mailed it via the U.S. postal system back to the research site.
Great. And so both e-consent and remote consent are part of the consent process, which is under IRB oversight. So each of those and all of it requires IRB review and approval, right?
Yes. Anything to do with the consent process or any changes to your consent process, including any documents, any wording, all of that has to be submitted to the IRB for review and approval. So with that, the IRB has to look at e-consent materials and tools that might be separate from the actual informed consent document, but are used to support the process. So maybe something like a data dictionary that the person's going to look at, or tools that the site might use to see if the participant is understanding the key elements of the study. An important thing to note with this topic, though, is that if a site has an approved paper consent form and they're just going to upload that to an electronic platform for storage, that storage itself is not an e-consent issue. Again, on our website, we have a document called the WCG IRB Guide for Researchers, and that has some really good specific information about when and how to submit e-consent information to WCG IRB.
So how would I know if you all approved my remote consent process or e-consent process? Is there something special?
If you include it in the protocol and you see that we approve the protocol, that means we approved that process. If you submitted it as maybe some information on your submission form or a separate document, you'll see sort of a blurb in our approval documentation that says the alternative consent process was approved, and that means you're good to go with your e-consent process.
That's great. And your prior references to the FDA guidance, I know there's a lot of FDA considerations, including the considerations under the regulations of 21 CFR Part 11. Does the IRB consider compliance with that part?
A teeny piece of Part 11 compliance is what the IRB is really concerned about, right? Part 11 compliance covers a lot of things. What the IRB is looking at is specifically if the consent signature will be obtained and documented electronically. So if you're doing that, and the research is FDA regulated, the IRB will ask you to confirm that the system that you're using to generate that electronic signature is compliant with Part 11. And for WCG, it's just a question on our form that you can say yes or no to. So a couple of caveats with that, though. Part 11 doesn't apply if you're getting a wet signature and then again uploading it to an electronic system just for storage. It also doesn't apply if the participant is signing a wet ink copy of the consent form and then they're uploading it and emailing it to the site. That doesn't need Part 11 compliance from the IRB perspective. There might be other parts of Part 11 that apply once you're down that path, but for IRB, that's all we care about.
Great. That makes sense for the IRB's responsibilities. Speaking of IRB responsibilities, there's no part of this or the electronic consent process or documentation that is different or separate, right? Do all consent elements and requirements still apply for electronic consents and electronic consenting?
Yes, of course. Yep. All of the elements required by FDA and OHRP regulations, whatever you're subject to, have to be present in the e-consent just as they would with the paper consent. If you're using an e-consent process, though, it's important to pay attention to the availability of the research team for questions and how a participant might get in touch with that person or with the research team. And then also, the regulations require that the participant receives a copy of the consent document. So you want to be thinking about how that process happens and if the participant gets a copy that's signed and dated.
That's great. And you pointed out a couple of times the FDA regulations and cited two different regulations. So what are the important parts about e-consent for non-FDA regulated research?
Yeah. So again, even if it's not FDA regulated, the IRB still must look at the consent process. Any changes you make to that process, that all requires IRB approval, regardless of your regulatory framework. A little bit of a difference is that if it's not subject to FDA regulation or it meets the criteria for a waiver of documentation of consent, you don't need to worry about Part 11 signature requirements. In the joint guidance that OHRP and FDA issued, there's a lot more information about some of the flexibilities allowed when you're documenting e-consent in a non-FDA regulated study.
That's great. And a couple times you mentioned our website and a couple resources there. People can go and read up on some more if they want to hear about it. So great to talk to you today, Erin. Anything else you'd like to share?
I believe that is it. I hope people get some good information out of our blog post. And if you don't, please contact us and we're always happy to answer any questions that you have.
Thanks so much, Erin. Talk to you later. Bye.
Thank you for joining us for this episode of WCG Talks Trials. Don't forget to subscribe to this podcast on your preferred listening platform as we continue to explore different areas of the clinical research industry. As always, we encourage you to join in the conversation. Feel free to reach out to us if you have any questions, comments, or suggestions for future topics you'd like to hear on the show by visiting us at wcgclinical.com/podcast. We're here to serve as a trusted resource as we work to improve lives and accelerate clinical research together.